So multiple MR images here demonstrate a large heterogeneous hypervascular mass arising from the upper pole of the right kidney. Now, anytime you see a renal mass that's enhancing to this degree, you have to think that it's likely to be a clear cell variant, which is what this is, a clear cell renal cell carcinoma. But just making the diagnosis isn't enough. You have to really stage the tumor and figure out what exactly it's doing and any complications that you might encounter during surgery. And notice in this case that not only is there a big mass in the kidney, but it's actually extending into the renal vein and extending into the IVC, including pretty high up into the hepatic IVC. So that's extensive tumor thrombus, and that is critical for the surgeon to be cognizant of prior to surgery because it really will impact their approach. Now remember, tumor thrombus in RCC does not necessarily prevent you from doing a surgical resection, but will definitely change the approach and the manner in which you undertake the resection.